and I want to welcome everybody who's joining us on this webinar today. My name is Nate Murray. I am a co-founder at Crossover Health. We are a primary health company, a medical group that delivers primary care, integrated mental health, physical therapy, chiropractic, health coaching, and care navigation for large employers. And we generally do this on their campus or near their campuses. I'm joined today by Dr. Michael Boroff. Michael's our clinical leader and program manager in mental health. Prior to joining Crossover, Michael was a psychologist and program manager at Kaiser. And he's worked in mental health focused public health programs in California, and did his predoctoral and postdoctoral training at Children's Hospital and Research Center in Oakland, California. Michael, welcome.
Thanks, Nate. Hello, everybody.
This is an unusual atmosphere. Usually you and I talk very casually. We're both Warriors fans, so we're rooting for the Warriors on Thursday night. Hopefully there's some Warrior fans on the phone. But we're really excited to talk to you. This is a topic that's very meaningful to Crossover. Just in the way of our history, we started delivering on-site health centers for large employers back in 2010. And since the very beginning, as we started to deliver primary care first, we recognized that we couldn't deliver effective primary care without integrating mental health therapy. And fortunately for us, that's been a key part of the services that we deliver, our care model. And thankfully, we've been able to recruit Michael here, and he's been here for the last handful of years to help build this mental health program for Crossover. So, Michael, as we get started here, I just want to know a little bit more about you and why did you get into this field as you were picking your career path?
Yeah, I always had really strong values around wanting to give back and better the world in some way. And I initially thought it was going to be through teaching. So many of the people who had impacted me as a young person were teachers. But mental health ended up becoming the avenue that was more appealing as I talked to young folks and found that so many of them were struggling with their mental health. And so went to school and became a psychologist, and initially was very drawn to the clinical work and worked in a lot of different systems. And over time, just realized that every system I was working in was really broken and wasn't really serving anybody involved. The therapists were burning out. The patients weren't getting great care. And so I started to broaden my lens and really start to think about things in terms of systems. And then Crossover gave me the opportunity to actually build a system that hopefully I could feel better about for everyone involved. And so here I am.
Awesome, thanks. And just for those people on the phone that are listening, can you provide a little context of how we deliver mental health care at Crossover? Is this a virtual setting? Is it app-based? Is it article-based? Is it, hey, let's sit in a counseling room and provide care? And then maybe just a little bit of the scope of the services that our therapists see kind of in the commercial employer setting.
Yeah, our mental health services, we try and be as flexible as possible to meet people where they are. Obviously, during the pandemic, we've done a lot of virtual care. Prior to that, we certainly did do virtual care, but a lot of it was in person, on site, all licensed professionals. We don't have a coaching, don't have a behavioral health coaching program in the way that some of the other vendors do. It's really built around trust and relationships. We know with mental health that is the largest predictor of outcomes is relationship with the therapist. So that's always been a big focus. We do really evidence-based care and we work collaboratively. And I'm a big believer in integrated care, and I know we'll talk more about this, but when the therapist can work collaboratively with the primary care doc, with the physical therapist, with a health coach who's working on lifestyle to provide wraparound whole person care for people, I'm a big believer that those are where we get the best outcomes.
Great. Awesome. Appreciate that. And last little question, the range of care that we see, the types of diagnoses, just for context setting, like what's a regular day for the therapists at Crossover?
Yeah, I think we see a lot of anxiety, a lot of work stress, people struggling to maintain work-life balance. A lot of people have a lot of career ambitions, but also have strong values around being there for their families and struggling with that. Certainly see depression, a lot of relationship concerns. I think some of that flows from that balance issue, people struggling with communication. And then we certainly see obsessive compulsive disorder, trauma, bipolar disorder, some of those other ones, not in the same volume, but we're able to care for most folks in our system, outside of things that really require a program, like more complex eating disorders, substance use disorders. We care for them in our system. We see couples as well.
Great. Awesome. All right. Well, appreciate that background. And let me just get started kind of big picture, and then we'll start to narrow down into, maybe some ways that employers can think about serving their members, serving their employees. So kind of big picture for me, Michael, I'm curious, you've been a provider for a while now, and I'm curious kind of the state of mental health in this country. What are some of the things that have you discouraged and concerned, and what are some of the things that give you a lot of optimism and hope?
Yeah, it's been really interesting over the last 2.5 years, especially. I think mental health has really entered into the spotlight, and we see so much venture capital money going towards mental health solutions as people try and solve for things. When I look at what has me discouraged, I think one, feels like we're repeating some of the same mistakes we've made. There's this continued push to segment mental health off from the rest of healthcare and have these siloed mental health solutions. And I think there's a role for those, but I'm concerned that that's becoming the predominant way that mental health is delivered. As I say to you, Nate, mental health doesn't occur in a vacuum. Our brains impact our bodies and vice versa. And I continue to wonder why we try and treat it as something separate and distinct from our physical health. So I worry about that. I worry as we have a national provider shortage. So many people are trying to solve for, we don't have enough therapists. How do we provide care? Feels like some shortcuts are being taken that maybe aren't helpful for people. AI has so much promise, but maybe hasn't moved far enough along to feel like a legitimate experience for people. So I think concerns there. And then obviously it's been a rough few weeks in this country. There have been a lot of horrific events. And I just think that at some point, aside from what we can do as therapists, we have to take a larger perspective as a society about the way that we're living our lives and the things that are causing all of these mental health concerns, because people are struggling more with their mental health than ever before. We're not doing well here. And I think there needs to be some larger systemic change about the way that we live as people in this country.
Yeah.
So those would be the cons.
I think, one thing I would say, just from a consumer perspective, non-expert by any opinion, the positives that I see are the lack of the stigma. The stigma seems to, it's not gone, but it starts to go away. And I think that we're starting to embrace the fact that, hey, look, this isn't something that should be pushed into a closet or, under the rug, that this is something that we should embrace, and it's just the reality. And when you start to embrace it, good things can happen, change can happen, positive outcomes can occur. And I know we get super excited by that, where somebody feels like they're in a dark place or an unfixable place. And then through activities and through a relationship with a provider, that can change. Then my concern, Michael, and I want to get your feedback on this, is that great, now it's becoming less of that stigmatized event, but then the more that it becomes less stigmatized, the more we see the need for more providers, and the shortage comes in, which is then concerning.
Yeah, I think both things are true. And I agree. I think there's far less stigma around mental health than there was, even 5 years ago. I think it's much more out there. Think about, we have some employer partners who are just doing an amazing job of normalizing conversations about mental health and encouraging vulnerability. And that's fantastic. And we have to be able to help those people when they come in and make sure that there's access, and not just access, but access to quality care. And I think that's something that we're still grappling with as a country. How do we do that in a way that works for everybody? And there's a lot of creative people working on it. And I think, we're still trying to figure that one out.
Hmm. Well, let me take that kind of point and provide another question here for you, that it steps into the employer take on mental health, and that is, I think, and hopefully there's employers on this call that are in a wide spectrum of their journey in mental health. Some have probably large solutions and integrated processes and really kind of mature solutions. Others are probably like, where do I start? So, over the last couple of years, I think I've definitely seen employers wanting to take the more public position that, hey, my carrier, whatever place I'm going to get this mental health, isn't getting it done. I need to take a stronger position and advocate for mental health to my own employees. What are your thoughts on this? Is this helping? Is it hurting? What's your take on the employer's push in this space?
Yeah, I obviously I hear a lot about it as well. Just and I know HR folks hear so many frustrations when they try to access like the panels through payers, and the wait times are really horrific in the community. And so there's a clear need to provide different solutions because those have failed. Even the EAPs are struggling to staff their models sometimes. And so it makes sense for HR people to look for other solutions. I think the positive of that is that employers are saying, hey, we want to take responsibility for this. We want to make sure that this care is available for people who need it. And I really appreciate and respect that. I think the challenge is that most people struggle to understand their health benefits, period. And the broader the menu of options gets, the more overwhelming it is for people. They don't know where to start. And sometimes, especially when there are multiple mental health solutions on a benefit package, people might access one that isn't the best fit for them. And maybe that's their first time seeking out mental health services. And it's a bad experience because it's not the right solution for them. And that can deter them from continuing to seek out services. So it's really hard unless somebody's organizing the benefits and helping people move to the solution that's right for them. It can just be overwhelming and challenging for the employee.
Yeah, I think that I'm on our benefits committee at Crossover. We're a self-funded employer, and we like a lot of employers want to take an active role in providing great mental health to our employees. And so I think that's a major positive, that employers are stepping up. They're not advocating that responsibility to somebody else. They're really making sure that it's a priority for them to serve their members. I think the challenge that I've experienced as a benefit committee member is that organizing the right structure for members to access mental health. I mean, there's a gazillion point solutions in the world, right? And in that process of trying to be that benevolent employer and doing everything that's good for our employees, there is a reality that we just fragment care more. We confuse it more. And I've caught myself once or twice the last couple of years staring at our benefits ecosystem, especially in the category of mental health. And ours obviously is simple because we have providers that are part of our medical group that can do this. But looking at the structure we create for our employees and seeing 5 or 6 different mental health solutions, and then taking a step back as a consumer and saying, wow, that actually might be more damaging than helping them find the outlet they need.
Yeah, I think about it from a number of different levels. One, we're always thinking about population health, and I think about that. If you're an employer, if you're a payer, you're really thinking about managing the health of your population. And when you silo off solutions, they're not communicating with each other. I know it's always so frustrating for us. We don't get claims data from some of the folks we work with. It's just so hard to know what's happening. And for these different solutions to actually communicate and partner together. So it becomes much more difficult to actually do that managing of the population health when things are fragmented. And then obviously, yeah, for at the kind of most basic level, it can be a real struggle for the employee to know how to navigate that system.
Yeah. Yeah, I absolutely agree. Let me start off as we start this discussion on measuring the value of mental health care. Let me start off with a little poll question for those participating. So in the response box that you guys are just seeing, answer the question: does your organization provide mental health care benefits to your employees through a standalone vendor? And I'll give you guys a minute to answer that question, yes or no, and I'll share the results. While you're thinking about that, which should be pretty simple, I also want to acknowledge that there's a Q&A box through this Zoom function. We'd love to answer any of your questions. I'll try to keep my eye on that throughout this discussion just to see if there's anything in context to what we're talking about, and answer those questions along the way.
Yeah, I really appreciate the interaction. It's a weird thing talking at a screen like this, not being able to see any of you, to know if this is resonating. So please do jump in, participate, ask questions, take advantage of having us here.
Great. And Hester, let's see how we did. Okay, so from the respondents, it looks like it's pretty evenly split. About 46% say yes, and they have something standalone. And about 54% say no, they don't. Okay, that's helpful. All right. So we've kind of talked big level. We talked about kind of the general employer momentum in this space and some of the pros and cons with that. Let's talk for a second about kind of you as a psychologist, as a mental health leader that's designing a program, how you're going about doing this. So my question to you is, as the guild leader at Crossover, what are you trying to improve to improve mental health for our members? And I've kind of teed this up with a few little cues here for you that you've provided to me. So Michael, talk to me just kind of broadly as the mental health guild leader at Crossover, how you're trying to do this, and let's walk through a couple of these points that you want to make.
Yeah, I think the first thing that was really important to me in taking over this program is implementing measurement-based care, or often in mental health, it's called feedback-informed treatment or feedback-informed care. And the research is really clear that when therapists are regularly measuring symptoms and therapeutic alliance with their patients, discussing that data with their patients and using it to inform treatment plans, the results are much better. The treatment's more effective, more efficient, and the experience of therapy is much more positive for patients. And so really wanted to implement that model. And I know we'll talk some about it, but that relationship-based piece is really important. And I think it's being lost a little bit as people try to kind of invent solutions to the mental health struggle we're having. When you look at the research about what drives change in therapy, it is overwhelmingly the relationship, more than the strategies, more than the skills. That relationship is a driver of change. And so it's so important that the relationship between our members and our therapists are solid. And so as part of the assessments that our members complete for each session, they have 3 therapeutic alliance questions they answer. Are we talking about what's most important? Do you feel understood and respected? Do you agree with the way that you're going about treatment? And the therapist sets the stage for that, saying, hey, I want that feedback. I'm here to be helpful to you. And if I'm not being helpful, I need to know so that we can shift this. So here is your opportunity as my patient to give me this feedback on an ongoing basis. And that actually allows for those course corrections throughout.
Hey, Michael, just real quick, just to be super clear, what you're saying though is in your delivery of care, and to make sure that you have a strong relationship with the member, you're actually asking them, you call it therapeutic alliances. You're actually asking the member, hey, am I a good provider for you? Like, is this working? We're not presuming that like, hey, just because they're coming in here that like the therapy and my style of interacting with this member is helping them.
Exactly.
Is that correct?
You got it. Exactly. Yep. And it's really important. You see a lot of solutions out there where they're like, hey, I'm going to give a PHQ-9 and measure depression. Maybe I'll do it at the beginning, the middle, and the end. I'll do a GAD for anxiety. They're not measuring that therapeutic alliance. They're not measuring it all the way along the line so that they can course correct and make changes. And so it's not really measurement-based care. Measurement-based care means that you are regularly doing this and shifting your care as a result. And it's a place where mental health has lagged far behind other aspects of healthcare, to our detriment. So it just feels like this can't be optional as we try and solve this dilemma.
Let me ask a question on this. So in a real life experience, you ask, and you said it was 3 questions to measure the relationship between the provider and the patient. You know, if they flag for, you know, indicating that they're not a good match, what happens?
Yeah. So there's a conversation that comes from a really kind of curious place. Like, hey, you know, I noticed maybe the score starts out low, or maybe it, you know, for me, many of the most powerful conversations are, hey, I've got perfect scores from this person. And then all of a sudden it drops a point or two. And I can see which item they've scored lower. And I ask about, like, hey, I noticed that compared to prior sessions, you're not feeling as good about our treatment plan. Can you talk to me about that? What caused you to score that lower today? And it could be that, hey, I recommended something to them the past session that their last 3 therapists had also recommended to them and it didn't work. And I didn't know that, and I didn't ask. I just kind of threw it out there. And that's their way to tell me, like, hey, you missed me. So I get to ask about it and then shift. And you do that. And then if it kind of happens, and sometimes it does with mental health treatment, that, you know, I try to do things differently and we're just not a match, then we want to get you connected with somebody else in our system who is a better fit. And not every, you know, therapists aren't the right fit for every person. And sometimes the therapeutic alliance scores are just reflective of that.
Yeah.
Mm-hmm.
I mean, from my personal experience on the medical side, just having a primary care doctor, having that relationship with that primary care doctor means the world to me. It actually allows me to go much faster because I don't have to regurgitate, you know, my history each time. And, you know, building that relationship so that we're starting from this place of trust, that we're able to move faster, and is been tremendously valuable for me.
Yeah.
Go ahead, Michael.
Yeah, you know, it's amazing when you build that relationship. Like, I just had somebody, a former patient, contact me after like 2 years. She did great, and now something else has come up, and she knows she can just reach out, send me a message, and say, "Hey, I'm struggling again. Can I talk to you?" And like that, you know, to get her in, and that's how I always want our model to work.
That's awesome. That's great. All right, let's hit another topic that often comes up, and I know it's part of your guild program, is this is a struggle for employers. I mean, I imagine there's people on the phone that are just in one market. Some are in every state in the country, some are in a region, and everything in between. And how do they think about tailored solutions? I mean, what you were just talking about, that relationship sounds fantastic, right? Well, how does an employer with employees in different markets and regions and nationally develop something that's tailored and can have the impact that you talked about with that relationship, but is also scalable?
Yeah. And that's the magic question, right? And I think everybody's trying to figure out, like, hey, how do you scale mental health and have it work for everybody involved? And I don't think anybody has a perfect answer for that yet. But I think what you don't want to do is kind of box people into one approach. And there's some great solutions out there. There are companies that have things that are maybe more asynchronous, where it's messaging based, and maybe there's curriculum that people work through and message back and forth. That's a great solution for some people and not for others. And so I think about, how do you have a quarterback, somebody who's kind of taking charge, like, hey, here's our benefit ecosystem. We want you to be the front door for people and make sure that they end up with the right kind of care for them. We build out as much infrastructure as we can within our system. And I also know that there's some levels of it that we won't probably ever build out. And so it's great to be able to tap into these benefit systems and get people into the right kind of care. And I think about that a lot. So many of the benefit, you know, kind of vendors are incentivized to keep people within their own services. because of the pay structure, the way that they're paid. We have EAP companies like that we work with, where the best thing for their company is to keep people with their providers, but the best thing for the patient may not be that. And I think we have to think about what is the right thing for the person in this case. How do we get them to the care that they're motivated to complete, that is the right fit for them? And so I think that really needs to be the driver of decisions if we're really wanting to do what's best for people.
Yeah, I think something that healthcare is really good at is we run a lot of interference before a member connects with the provider, right? Like we are really good at that, and we think it brings scale, but it probably just brings a lot more confusion, right? And I think having the right licensure in every state, you can deliver a scalable solution that's relationship based, and I want to say affordable, without all that interference that you have to navigate through. So you've got another mental health issue by the time you get to the provider, because you've got a lot of stress just from navigating healthcare.
Yeah, authorizations to receive mental health, just brutal. And obviously the whole fee for service system is a problem there too. But yeah, that is to me not the way to scale mental health. Utilization review, where you need to have a certain level of symptoms in order to be seen, or this is when you're forced to kind of graduate from therapy. That's not the right way to do this. And I get why people try it. They're trying to make the most of their limited resources, but the impact of that can be pretty devastating for the people who really need that care.
Yeah.
In our system, people can jump on and schedule themselves for an initial appointment when they want to schedule an initial appointment, and we'll meet with them, we'll assess, and we'll figure out with them what the right kind of care is. And we train our providers to make the right decisions in those situations. And I think that's a far more compassionate approach.
Hey, so two questions came up that I think are relevant to this topic on scalable solutions. Let me ask you both of those. First of all, as you think about tailored and scalable solutions, what happens when you've got a person that's in crisis at the moment, maybe contemplating suicide? Like, how does the scalable solution solve for that person in this crisis moment?
Yeah, I think about how many inundated systems there are, and people who are in crisis and struggle to get in, their kind of darkest moments, and they have a hard time getting through, have a hard time getting in to see people, to see licensed providers. And that's a whole nother thing that maybe we'll talk about, but really, really important that when people do outreach and are in crisis, that they can get the care they need as quickly as possible. So I think about this as a place where technology really does help. In our virtual system, somebody sends a message saying, "Hey, I have a mental health concern. I need to talk to somebody," and we get back to them in 30 minutes. Within 30 minutes, we're reaching out, assessing, figuring out what needs to happen, and getting them to the kind of care they need. So I think you really want to have those easy paths towards care.
Yeah. The other question that came up was a question about EAP bundling. It says, does it make sense to continue to bundle your mental health with your EAP partner? I always find this a little curious, because I think that this is probably something that I don't even know when it originated, combining mental health and EAP in the same, probably originated 20, 30, 40 years ago as a convenience. And today, when we think about mental health, it's clearly a medical issue. And the fact that it sits over an EAP sometimes is always very curious to me. But anyway, I'd love your thoughts on that one.
Yeah, I have the same, in my, one of the things I love about my job is I constantly get to ask myself, why? Like, why do we do it this way? Just forget what's always been done, but actually think about why. And this is one of those I'm really curious about as well. I think part of the why is probably, as we said earlier, the payers have struggled to provide mental health services. And so EAP saw an opportunity and jumped in to do this. But again, if, and for those of you who are designing benefit ecosystems, like imagine you wanted to design the ideal healthcare system for your employees. Would that involve a completely different solution for mental health than all of the rest of the healthcare that's involved? Like, would you build it that way? And if so, why? I think sometimes people say, well, there's stigma involved. And I would actually argue that one of the best ways to address stigma is by integrating mental health services with the rest of primary care, by normalizing it as part of our healthcare system, by having doctors have relationships with the therapists, and being able to, really speak to their patients about, hey, I work with this person, even pulling them into the room to actually meet the person for a few minutes to do that warm handoff. It just can't happen with EAPs or these point solutions. And then it also, we talked about measurement and outcomes. And I ask the employers we work with, well, what kind of data do you get from the EAPs to show that it's effective? And the answer is almost always, we get utilization data. Like, okay, but is it helping? Is it good? Is it quality access? Are people getting better? What's the experience that your employees have with these folks? And it's not often positive. And one of the challenges, and I think we're all struggling with this, therapists have more options than ever before right now for where they want to work. There's so many, if I said, you know what, I don't want to be a crossover anymore, I want another job, I could, within a week, I could go land another job. Don't worry, Nate, I'm not going anywhere. I love what I do, but they're just, there's so many options for therapists, and EAPs don't typically pay very well. There's some exceptions to that. There's some kind of some interesting solutions out there that are paying better, but the quality of providers and their ability to maintain their panels so that there's actually access. I really wonder about why we do it this way. It doesn't seem to make sense to me.
Gotcha. That's helpful. I do want to add for those attending that, these are obviously Michael's clinical opinions, but some of these are from the perspective, our opinions from the perspective of crossover as a self-funded employer. Like, we are trying to solve the same problems that you guys are. And so we have that experience of wrestling with these challenges. So, this was a slide, Michael, that you had shared with me, just talking about, I think, some of the pain points with addressing access, the scaled and tailored solution. Obviously, 48 days for wait time to get your first appointment is pretty rough. Even when I look at crossover at 6.6 days, I cringe a little bit, but it's helpful to know that if somebody is in a crisis moment, they're able to get care right away, that you've built the process to allow those people to get in.
Yeah, and I think, the 6.6 days varies depending on where somebody is. And if they call in crisis, we can see them the same day. I was in another conference where one of the mental health vendors had done a kind of a secret shopper study of one of the major payers, and they called hundreds of therapists on this payer panel. 75% of them either weren't taking patients or just flat out didn't return the phone calls. Another 15% didn't have anything available for at least a month. And so like 10% left had something within a month to be seen. And that's demoralizing. And I know plenty of people who've had this experience where, like, hey, here's the list, I'm going to start calling people. I don't even know if these people are a good fit for my concern or who I am as a person, but I just need somebody to actually respond to my phone call and get me an appointment. And when you're depressed or you're feeling really anxious or you've just suffered a major loss, like, it's just so easy to give up in that process. It's horrible.
Great. Well, let me move on. You've mentioned throughout your early comments about measurement-based care, measured outcomes in success. What do you mean by that? Describe your program, and then we've got a couple of slides here that I'll kind of advance to that maybe make this case even better. So talk to us a little bit about what you mean by measurement-based mental health care.
Yeah, and I think about it on 3 or even 4 different levels. The first I've spoken about quite a bit already, which is, hey, the therapist is actually collecting and using the data in collaboration with their patients to provide the best treatment possible. And it's amazing, when therapists really buy into this, they love it, and patients actually love it too. It's hard to, this isn't unique to mental health. It's hard to actually improve things that we're not measuring. There's a reason why, like, fitness watches and things like that are so popular. That feedback actually motivates people. And so it's really hugely helpful in therapy to collect those outcomes. And I think, again, thinking beyond just depression or anxiety, but thinking about functioning, thinking about relationship satisfaction, emotional well-being, substance use, being able to actually track those on an ongoing basis so that we're providing the right kind of care is so important. And then if you move that up a level, think about managing therapists. And when I started a crossover, and obviously I've had this experience managing people before, therapists before, I have no clue whether or not the therapy is working or not as a manager. Like, I don't know what the quality of unless there's a complaint and then I know something's not going well, I really don't have any visibility into what's happening. And so arming our managers with data about therapist performance helps us ensure quality and helps us lift up people who are struggling, providing them with extra attention, helps us recognize therapists who are just rock star performers. And then as a larger company, we're able to look at our actual population and understand who's receiving mental health services, what they're struggling with, how we need to alter our programming to impact what's happening. And then also with our employer and payer partners to be able to report out to them about outcomes. Not just did your people use it, but are they getting better? And here's the data to show it. Or, hey, we've noticed that your population compared to the rest of our book of business really is struggling with this. Can we talk about what's happening in your space as an employer that where there might be some changes you all could make that would benefit the mental health of your population? We're true partners in that way. And I think that, an ideal solution, that's what they're doing. They're partnering with the employer, the payer to solve these kinds of problems.
Yeah, and I think this, to your point, the industry standard is to not really use tools to measure, right? And I think, my personal opinion is that's a function of the reimbursement models that's out there, right? Getting somebody healthy is bad for business. And it's just it's a tragedy that fee for service is like that, right? You need to, in the mental health care case, you need to get a patient and then develop that relationship, and that becomes a monthly engagement, right? And so using tools, I don't think people get into the business of becoming a psychologist to do that. It's just that's how the economics work, and to survive and help people, that's kind of how you have to do it. Now, you of course have brought a different focus to Crossover, which is introducing progress measures, standardizing how we measure member improvement. Can you talk a little bit about the things that we're doing that measure that member improvement?
Yeah, and just piggybacking a little bit off of what you said before that, I think it's also important to note that our therapists are all employees of Crossover. They're not contractors. And I think that kind of reinforces that challenge you were talking about. When these are people's private practices where they get paid based off of people showing up and keeping their schedules full, they are incentivized to hold on to people for a longer period of time. And I think it's also true, a lot of patients want to hold on to their therapist too. It's a special relationship, and it's often for so many folks the one place in their life where they are listened to and validated. And so it's really hard to let go of that. And we really want to foster independence and people building those support systems outside of the therapeutic relationship so that we can be available to the next person who really needs us. And having that kind of control over it when they're contractors is really challenging. I know some of the vendors are now starting to kind of pay the therapist to graduate people from their panels. They get financially incentivize them to move people on from treatment. And that's a whole nother can of worms. There's lots of opportunity for abuse there. So
this slide, to your point, indicates that, hey, all of the providers that are, are employed by Crossover use those mental health standards. And then what's the result? What does this slide share about, some of the results that we capture?
Yeah, we looked at, after we implemented measurement-based care, some of the impacts of that, and just what did our outcomes look like. And so with the BHI score, this is our kind of overall mental health functioning score. It's at 0 to 100. The higher somebody's score, the more severe they are compared to other people in outpatient mental health. And we saw a 30% drop in those scores. So really solid decrease in that measure, which is really a fantastic result. And we see that with our effect sizes as well. Our therapists are performing really well. And part of the reason they're performing really well is that they're actually collecting and using this data to inform what's happening. I also think that the ease of access and the integrated care system also helps us drive better outcomes than maybe other solutions that are out there. In the comparison sample we had, saw about a 10% drop in that BHI score over that same period of time we looked at. So really seeing outstanding results. And I think this is the important thing, if you're an employer and you're looking at your mental health benefit options, think about this, like, hey, what data are they going to provide to me to show that it's actually working, that it's helpful? There are more folks doing this than there used to be. But I think it's a really important question to ask them when you're considering not just access, but quality of access.
Yeah. And I like this slide. I know that this is just one data point which we measure. Another one that's been really relevant. It's been relevant forever, but for some reason, the employer community have found it to be, consultants and payers, a bigger buzzword, which is the social determinants of health, right? And I know that's something that as we work in an integrated care model, is something really important for us to measure the prevalence of those social determinants of health and the improvement. So right before we jump to integration, an integrated care model, let's ask a second poll question. Do you know if the mental health care benefits you're providing your employees are helping them? Great question. We don't know for certain. Yes, we receive anecdotal employee feedback, or yes, we receive employee utilization data from the mental health care vendor.
And what we don't have up there is, yes, we receive outcomes data from the mental health care vendor. So that's our, we should have that one up there too.
Yeah. Okay, let's see what people say here. Okay, so wow, that is not surprising. 80% nearly said we don't know for certain. 11% say yes, we received some anecdotal employee feedback. That's positive. Anything is helpful. And then yes, we receive employee utilization data from the mental health care provider. Again, I think the utilization data, as you talked about, is a struggle, because just saying that people are going, I mean, that's good. But like in your BHI index that you measured, demonstrating that people's severity is decreasing and that there is clinical improvement is something that's really important. So I think that that's helpful. Let's transition to one of the final topics here, which is kind of the integration with the care team. And I'll jump to this next kind of data point, which says 70% of primary care visits stem from psychosocial issues. And, I can just say, when we started Crossover, we started this comprehensive primary care model. And what we originally started to identify is that with every chronic condition, with every diagnosis, there was always some lingering or companion mental health issue that was taking place. And to really address that, we had to bring in some mental health services. So Michael, what is your take on the integrative models that are out there today?
Yeah. As a note, before I dive into that, there's a paper that's cited down here at the bottom from the American Medical Association. Really recommend, if you're involved in benefit decision-making, to take a look at that. And the whole emphasis of that paper is why integrated care, integrated and that behavioral health, mental health is so, so important, how technology can help with that. And then how each level of everybody who's responsible for healthcare can impact this, including employers. I think I mentioned earlier, brain, body, mind, body are connected. That's just the reality of it. If you are diagnosed with diabetes, there's going to be, in all likelihood, some mental health stuff that pops up with that: depression, anxiety, adjustment to that. And then that mental health stuff may impact my ability to follow the treatment plan from my doctor to control my diabetes. And I think about those all chronic pain, and we think about like the opioid epidemic, and how often opioids are actually used to medicate psychological pain. It's reported as physical pain, but it's actually psychological pain. When you have the therapist right in house, collaborating with the doctor, it's just a much clearer path forward for providing that whole body, whole person care for people. When you refer people outside of the walls of your clinic, especially people who are maybe a little bit ambivalent about mental health services, so many of them drop off. They don't make it. That connection it just never happens. And it gets worse over time instead of getting better. So I'm just such a huge believer in actually integrated care. And I think it's another really important question for people to ask themselves is there an integrated primary care home for my employees that has mental health, that actually takes mental health seriously? It's not just there as an add-on, it's a core part of the care team. Think about how often I collaborate with the primary care docs of my patients around treatment plans, around medication. And so often in our system, primary care docs are the ones prescribing antidepressants and sleep medications, things like that. When you have an integrated system, there's just an ease of communication in there that just makes sure that our patients are really getting what they need. And in the end, that's the thing we want to do right by the people we're serving.
Michael, just help me and maybe paint the picture for those on this webinar. What does integrative care really look like? Like, what's your proximity to the provider? Do you guys share a panel? How are you communicating on patients? Is it frequent? Is it infrequent? What is that really like? Because when I think about integrated care, I think like, there's probably models that look more fragmented, some that seem closer. Do you guys operate as a single care team? Like, what is the experience for the member when you're saying, hey, an integrated care model is better?
Yeah. And I think it's a really good call, Nate, that there are a lot of different approaches to integrated care. As I worked for Kaiser for 4.5 years. That's an integrated system in one sense. I shared an EHR. I could send messages to the doctors who were treating my patients. I never met them. I didn't know who they were. We didn't have a relationship like that. At Crossover, when I go in between patients, I sit in a bullpen right across from the doctor who's also working with my patients. They're right there. I have organic communication with them. I know them as people, not just as people on the other side of a screen somewhere. So we're not just co-located. We're not just sharing an EHR. We are embedded in the same space. And if they're in with somebody and maybe that person is a little bit ambivalent, saying, hey, I'm just not sure about mental health. Like, aren't those people just weirdos? Like, people are going to think I'm crazy. Doctor could say, hey, I actually have one of the therapists available. Would it be okay if they pop into the room right now and just introduce themselves? And you can actually ask them questions about what therapy is, how it works. And if you want to do it, great. And we can do that in our space because we're all right there together. And I just think that's a powerful experience.
Great.
Yeah.
Okay, we're running short on time, and I want to get to kind of covered this one. A data point says 1 in 10 patients seen in primary care were diagnosed with depression or anxiety. It goes along with your integrated model that, hey, if you've got a diabetic, there's likely a companion mental health issue that's going on there. And so let's ask another poll question, give people an opportunity to throw in any other final Q&A that they have. I got a couple of questions that I'm going to select from here that I want to make sure we get asked from the audience here. But the poll question 3 says, should mental health care be provided as a part of an integrated care model? Curious from those attending what your take is. Yes or no? Should mental health care be provided as a part of an integrated care model?
And you can totally disagree with me if you disagreed with my perspectives. I don't have the right answers for everything.
And if you do disagree, toss in a comment and say why, and that would be something to discuss. But
yeah,
let's see what the answer is here. So, well, everybody said yes. So I think we have confirmation there that people believe it should be part of the integrated. Now, how do we get there, right? Doing that hard work to get there. I want to ask a couple of questions that I think might be relevant to this discussion, and I think people would be interested in your feedback on this, Michael. What role do self-guided apps and AI have in addressing mental health demand challenges?
Yeah, that's a really good question. I think they work for some people. I think when you look at the kind of self-guided apps, which basically is just self-help, but in an app form instead of a book, you can go into Barnes and Noble and pick up a book about depression and work by yourself on your depression. The research on that shows that the drop-off is pretty significant. About 80% of people stopped using it within 10 days. It's really hard without a human point of contact to stick with those tools. And so I think that's still a struggle. There are some really self-driven, motivated people who can pick it up and run with it. But, I won't go through and name them, but some of them, we have employers say, well, what about this or what about that? And it just, I haven't seen the self-guided apps work for most people. Most people want to be.
Well, let me ask, what about with there's a self-guided app with like a non-clinical coach, like a kind of a somebody is it get better with that?
It does get better with that. When there's a human point of contact, that makes a big difference. And it's funny, I have people who come in and see me saying, I actually know what I need to do, but I need somebody to help hold me accountable. I have people say that often when they come in. So I think that does help to a degree. And I think there's a role for coaches and non-licensed people in care. But I think, again, it's something that works for a percentage of people, a smaller percentage of people than other solutions. I think AI is similar. There's, like Woebot and things like that have some evidence to show they can be really helpful for people. Also heard it really turn people off. I recall one kind of HR decision maker who had been working with a vendor and had been in therapy herself. And she wrote in and it's saying, hey, my anxiety is worse, trying to get in contact with a therapist. And the AI bot responded with an article about anxiety for her to read. And the therapist didn't respond. And that was just a massive turnoff to the point where they said, we're done with this company. We actually want human beings working with us here. So until AI starts passing the Turing test, I think there are going to be continued challenges about that as a solution for what's going on. You also see AI being used, and we get contacted by these folks. The AI can listen in on primary care sessions and based off of how people talk, identify whether they're depressed or anxious. AI kind of looking at even messaging patterns and starting to pick up on that. It's really interesting. There's also a creepiness factor there, and I don't know how the average person's going to feel about a computer listening to their sessions and coming to those conclusions. I think there's going to be a lot of concerns about security and safety with that.
Gotcha. That's super helpful. And these have been great questions. I want to see if I've got most of them. Yeah, some of these are duplicates, so I think we're doing pretty well, and we're just running short on time. So I want to kind of close out with a couple of final points and some of the key takeaways. Again, I'd love to emphasize that our comments are our experience, right? Clinical mixed with our business experience from running a self-funded health plan and just trying to fight like folks on the phone in delivering the best benefit strategies for our own employees. And so as we think about that, and contemplate what might be helpful for you. I think something that's going to be important is that you guys are able to think about your mental health care benefits and ask yourself questions like, do you know how well they're serving your organization and your employees? Like, that's a tough thing to always get at, right? You're going to get some anecdotal feedback, but are you seeing an impact in your culture? We use a Gallup survey here to measure lots of different question sets. Those aren't always meant to be, clinical mental health question sets, but there's got to be ways to measure if you're improving in this category. And that's something that we do. We implemented the social determinants of health screening in the aggregate, and we're able to look at that as a company and see, like, hey, are we identifying that our employees are improving and getting to a better place? And so potentially that's something that you're able to do. Does the structure provide opportunities for employees to build relationships? Michael talked about that we spend a lot of time running interference between a member and their provider. And yet there's a lot of organizations just like, we can cut out all of that stuff in the middle. We can connect providers with a member to just make it super streamlined and build that relationship. I love, Michael, your story about one of your patients from a couple of years ago being able to re-engage with you because, you were available to them. And, it's just a little extra coaching with a new issue that arose. So do you know if your employees are getting better? Is your mental health care offering integrated with your primary care model? Important questions, right? To ask yourself, are you seeing that? We're starting to see more payer solutions trying to take different medical group entities and bring them closer together. I think that's better than not having that. At the same time, I think, Michael, what you described of being able to sit across from your physician peer, your health coach peer, your physical therapist peer, or care navigator peer, and talk about, specific care for a member on your panel is probably the best, right? That is going to provide the best outcome and experience for that member because everybody's talking about, the same person. And let's conclude then with a final poll question. This is the most important poll question of the set. Would you like to be contacted to learn more about Crossover Health's proven primary health model and our approach to mental health care? We don't even have to look at the results. It should all be yes. But in all seriousness, if there's opportunities for us to provide feedback to you, consultations to you on, programs that you're looking at, we're happy to do that. We serve a lot of large self-funded national employers, complex entities, but you may be a small company and you may have specific questions. And we're happy to help you think through some different strategies, even where we're not, able to specifically help you. We might be too big or whatever the case may be. But hopefully you guys feel comfortable reaching out to us. Hester will show the results of that. But I want to make sure you guys have my personal contact information, and feel free to connect with me, shoot me an email, connect with me on LinkedIn. And I'd love to make sure that we can answer any of those questions that you guys might have. Okay, Michael, any closing thoughts?
No, I think you summed it up well. We're all in this together and all trying to kind of fix this healthcare system that is just not working, and mental health care system included in that. So just let us know how we can be helpful. And I hope that there was something you took away from this that will lead to, further action on your part. I always think about that with these presentations is like, hey, what's your commitment coming out of this? And so hopefully there's some kind of commitment that you came out of this with.